Now there is an 8,000 square foot pharmacy in Fresno, but it doesn't have a drive-up window or you won't be standing in line for a prescription. This pharmacy serves the needs of more than 29,000 hospital patient admissions each year at Community Regional Medical Center. Well, pharmacists from this in-house patient pharmacy are all spread throughout the hospital to speed up the pharmacy process. They have a new goal in mind, and the Pharmacy Point of Care pilot project is putting pharmacists on the floors and at the bedside to improve patient care throughout the hospital.
When Community Regional Medical Center pharmacist Julius Chang heard about a pilot project at Community Regional, he jumped at the chance to participate.
This point of care project is something that we wanted to try to see if it would work, where we have a pharmacist working on the floor, which would improve pharmacy services to patient care.
The point of care pharmacist would review the patient's chart and enter the order on the floor.
Basically how it works right now is that the orders that physicians write would come down to the pharmacy, and the pharmacist downstairs would review the order to see if there's drug interactions with the new order that was written, and if there's any drug allergies that the patient has, to see if this medication that the physician writes is appropriate for the patient.
The patient would like to know what he can and can't eat.
Okay, I could go talk to him right now.
Pharmacists on the floor work one-on-one with the patients and medical staff.
I usually go up to the patient and then talk about certain medications. If there's a unique medication that the patient is on, I would talk to them and counsel them on what the medication is being used for, some of the side effects that may occur with the medication.
Dr. Danny Vera, Community Regional's Director of Pharmacy, is eager to place more pharmacists throughout the hospital in more acute care settings.
And really what we're trying to accomplish is having the pharmacists at the bedside, being part of the healthcare team, including physicians, nurses, dietitians, to really be involved with the overall care for the patient. If there's a dose adjustment, you would write the order and then write the note based on what the adjustment that you made.
Dr. Vera says he has seen many positive results with the pilot program.
What the initial findings is the nurses felt that the turnaround time for acquiring their medications was much quicker having the pharmacist there being involved when the order was written.
He says there are other additional benefits to the Pharmacy Point of Care program.
They can really help make recommendations to the physicians and nurses related to appropriate therapy for appropriate indications, meaning if we're trying to treat a specific bacterial infection, what is the best antibiotic that is the most cost efficient to meet the needs of that patient? The other benefit you'll see is they are a great resource in preventing drug interactions, allergy, adverse drug events.
Dr. Chang certainly saw positive results with the patients and the medical staff as well.
I really enjoyed working there, and the nurses really had a good experience having a pharmacist on the floor, answering drug information questions, and receiving medications quicker from pharmacy, especially having a pharmacist on the floor.
Besides the inpatient pharmacy, Community Regional currently has 3 critical care pharmacists and an emergency department, infectious disease, and ambulatory care pharmacist.
So we're looking to our higher acuity patients, such as our ICU, or our step-down patients, or our telemetry patients, such as the pilot program, to really focus our efforts on those patients who have a higher need of acuity and who have higher medication needs based on their reason for being in the hospital.
As always, Community's goal with this pilot project is to improve on patient care.
From processing orders to providing drug information to physicians and nurses to reviewing for allergies and drug interactions on a consistent basis, and we really feel that the pharmacist can have the most impact at the bedside.
Dr. Chang agrees that having a pharmacist on floor and by the bedside will help both medical staff and patient care alike.
Do you have any allergies to any medications? I really do enjoy, working with different types of healthcare providers. Being the only pharmacist there, you're kind of a unique person on the job.
A unique and valuable asset for quality patient care. For more information on Community's Pharmacy Point of Care pilot project, log on to MedWatchToday.com.